Alright, so for this first test, I'm going to be performing the pronator teres manual muscle test. For this muscle test, you want your patient to be lying supine on the table. You want to have their arm next to their body, brace at the elbow, have their arm or elbow flexed to 90 degrees of flexion, have them pronated, and then you are going to force supination on them and have them hold in pronation. Alright, hold it for, I'm going to count to 5. Alright, hold it for me. Ready? Go. 1, 2, 3, 4, 5. Rest. You're good. Alright, you want to grade this on a scale of 1 to 5, 5 being the strongest, 1 being the weakest. For this next test, I'm going to be doing the pronator quadratus. Like the pronator teres, you're going to have your patient lying supine. You're going to want their arm right next to their body. Instead of 90 degrees of flexion, you want to come back as far as they can. Keep their arm pronated, and you're going to, once again, force supination to isolate this muscle. So, I'm going to count to 5. Hold it for me. Ready? Go. 1, 2, 3, 4, 5. Rest. And once again, you want to grade this on a scale of 1 to 5. Alright, the next test I'm going to be performing is the flexor carpi radialis test, manual muscle test. So for this, you want to have your patient sitting in a stool with their arm on the table, wrist on the table. You want to stabilize up at the upper arm. You want to have them in flexion of the wrist and radial deviation. And you're going to ask them to hold it, and you're going to push into extension and ulnar deviation. So, hold it for me, Reed. Ready, go. 1, 2, 3, 4, 5. Rest. There you go. And you're going to grade this on a scale of 1 to 5 for strength. Alright, the next test I'm going to be doing is the flexor carpi ulnaris test. Like the flexor carpi radialis test, you're going to have the patient sitting in a stool, wrist on the table, arm on the table. You're going to be bracing up here at the upper arm, and you are going to want to put them into flexion and ulnar deviation. Now with this test, you're going to push them into extension and radial deviation. So hold this for me, Reed. Ready, go. 1, 2, 3, 4, 5. Relax. Alright, the next test I'm going to be doing is the palmaris longus test. Now, when you're doing this test, you want to make sure your patient actually has the palmaris longus, and to do that, you want to put their wrist into flexion, and then you want to have their thumb in abduction and bring it in to touch their pinky. As you can see, Reed has the palmaris longus right there. When you're testing this, you want to brace, once again at the upper arm, and you're going to want to push them into extension. So, hold this for me, Reed. Ready, go. 1, 2, 3, 4, 5. And you're going to be grading this on a scale of 1 to 5 for strength. Alright, the next test I'm going to be doing is the flexor digitorum profundus and superficialis test. For these tests, you want to have your patient sitting down on a stool, arm on the table. You're going to stabilize the hand, and then you're going to have patient flex their MP joint of the index finger and PIP joint. And for the superficialis test, you're going to push right on the proximal phalange. For this, alright, so Reed, hold this. Ready? Go. 1, 2, 3, 4, 5. Rest. And then when you're doing profundus, you're going to have them in DIP flexion. You're going to stabilize at the MP, and then you're going to push. Hold it. Ready? Go. 1, 2, 3, 4, 5. Rest. There you go. Alright, this next test that I'm going to be doing is the flexor pollicis longus test. For this test, you want to have your patient sitting in a stool, arm on the table. You're going to have them flex their thumb, and you're going to stabilize at the wrist, and you're going to pull them into extension. So, Reed, hold your thumb in place for me. Ready, go. 1, 2, 3, 4, 5. Stop. Alright, the next manual muscle test I'm going to be performing is the extensor pollicis longus and brevis test. For this test, you want your patient sitting in a stool, arm on the table. You want to stabilize at the thumb. You want to have their thumb in extension. And you want to try and push them into flexion. For brevis, you're going to push at the PIP, the proximal phalange. I'm sorry. Alright, so Reed, hold this for me. Ready? Go. 1, 2, 3, 4, 5. And then for the longest, you're gonna push from the very top of the thumb. Ready? Hold it in place for me. Ready? Go. 1, 2, 3, 4, 5.
I will be doing abductor pollicis longus. You keep their forearm on the table and you stabilize at the end of the thumb here, and you put their thumb into abduction like that. Put your hand. Good. And so you stabilize here, and for abductor pollicis longus, you press at the distal phalanx down into abduction. Good. Next, I'll be doing extensor indices, which is for the first finger. You'll have their arm pronated on the table and their first finger extended. So put your finger into extension like this, and you stabilize at the wrist, and you push down for 5 seconds. Hold it. Ready? Good. Next, I'm doing extensor digitorum, and this one you have their arm still pronated on the table, and you ask them to extend all their fingers like this, and you stabilize at the wrist and push down at the proximal phalanx for 5 seconds. Good. Next, I'm doing extensor digiti minimi. So with this one, you're using the pinky finger or the 5th finger, and with this one, you just have them extend their finger like the indices and the digitorum, and you press down at the proximal phalanx. Hold it for 5 seconds. Ready? Good. Next, I'm doing extensor carpi ulnaris. This one, you have their arm pronated on the table. You extend their wrist and into ulnar deviation. You stabilize at the forearm, and you push into radial deviation and flexion. So hold this. Ready? Good. Now I'm doing extensor carpi radialis longus and brevis. With extensor carpi radialis longus, you extend the wrist and turn into radial deviation. You stabilize at the forearm, and you push into ulnar deviation and flexion. So hold this. Ready? Good. And with brevis, you do the same thing, but with just wrist extension, and you push them into flexion. So hold this. Good. Next, I'm doing the supinator muscle. With this test, you can have your patient either standing or sitting on a table. So with this, you want their arm, their shoulder extension. You stabilize at the upper arm, and you hold at the wrist, and you try and pull them into pronation. So hold this. Ready?